We will now illustrate the first opening of the program. It is somewhat different from future openings because you have to go through a license agreement with the AMA. Locate the actual charges shortcut and double click. This will open up a screen that is basically called a shrink wrap screen, and you're asked to read this before continuing. It basically means that you're reading it and that if you agree with the terms, you can use the program, and if you disagree with the terms, you should return the program within 90 days, and document has been removed from your computer and your payment will be refunded. So we'll click continue. You have a reminder to enter the current date, and then we will go here and enter the current date. The next part, click yes if you agree to the end user license agreement. You'll have a chance to review this in detail, but for now, if you click yes, you will have an option to print the end user agreement with documentation. I would suggest you click this. It will take you through several screens, allowing you to print this document. And I'm going to print it to an Adobe PDF. And I'm going to change printer to go back to Adobe. I'm going to say OK. And then I'll have to give it a name. And I'll just make up a name. Save it. And once you have printed this, you will need to actually print it in paper form so that you can fill out some additional information. This is about a 9-page document. And once you have printed that PDF, you can then click continue. And this is the screen that you will see typically on opening. Once you've agreed to the license agreement, you don't have to go through that software agreement process again. And this screen is fairly simple. You have the ability to search for provider cost using Medicare information or non-Medicare information. The Western United States has about 3.3 million records in it. The Eastern United States has a little over 6 million records. And each record is a specific physician, a specific CPT code, and a specific location, either office or facility. And so let's look for just a basic information to begin to illustrate this. We will click here to begin. This brings up a search screen, and let's make it simple. You can put in HCPCS code, states, city, provider type, name, but let's just look for 99213, and we'll look in Arizona, and we'll look for internal medicine. And why don't we go ahead and look in Phoenix. As you can see, that types ahead, so I'm going to choose Phoenix. So on this interface screen, we're looking for a certain CPT code, certain state, certain city, and a provider type. We click continue, and this will then bring up the found records. Now I'm going to make this larger so that we can see it easier. So each record is a specific healthcare provider with a provider type, and we were looking for internal medicine, a certain CPT code, and then it will tell you the number of Medicare patients this physician saw during 2015 for that service, and how many of those services that provider provided on those 105 patients. And then the average submitted charge by Dr. Post was $291.96. The individual's name typically has address, and if you click on the little question mark, it will also show the phone number, fax number, specializations if they have any. Notice that we look for CPT code 99213, and it grouped them by facility. And then once all the facility codes were reviewed, it then grouped it by office setting. So going back, Dr. Post had a service count of 416, and the reports print out in the descending order of how many times they rendered the service. So this number becomes smaller as you go through. This is a good way to look for physicians in a city, in a particular specialty, in a particular CPT code, to see what would be the average submitted charge on those 418 encounters. And this number comes from the CMS 1500. I believe it could be represented as the posted charge or the charge in the charge master. And it varies from physician to physician sometimes, and I have no explanation for that. But often, if I'm looking for a service, I will get this kind of information, then I will call the physician and then ask what their current charges are. And having this information, it makes it easier to have some sense of what might be a reasonable range of service. The other information that's helpful, you see a small question mark here. If you click on that, it shows you if this physician has any additional specific certifications. Specializations. The specializations are actually identified by the healthcare provider themselves. The provider type is based on the Medicare criteria for indicating a provider type. And I think the best example of that would be sometimes the provider type may be an anesthesiologist, but also they're a pain specialist, and sometimes they submit services under both categories. But Medicare typically will make the provider type the number of the most frequently provided service under a particular description, such as internal medicine or pain specialist. You can look at the reports that could be printed. You actually have a choice of two reports. You can print report 1 or print report 2. The big difference is on report 2, you have additional space and more information about the physician. But let's preview report 1, and we're going to preview it at 150 zoom level. And this is what the report would look like if it prints out. Now, because we're in a print preview mode, you will use the arrows at the top left to go from page to page. And you can see it says page 3, page 4, and essentially this page often has enough space that the phone number will be listed if there's a phone number in the database. When you finish looking at the print preview, click Continue. It brings us back to the 150% zoom level so that we can see it easier at this point. And let's preview report 2 at the 150% zoom level. And this is an example of how you have additional space. You not only have space for the phone numbers if they have them, but you have 4 locations for specializations. And this will allow you to see if the healthcare provider has self-designated certain specialties. And we'll look through here and we can see that this particular physician he is an internal medicine physician, very likely by training, but he has specialties in interventional cardiology and cardiovascular disease. At a later point, we will talk about the source for these specializations. It's a national database. I think it's maintained by a federal or quasi-federal agency. And this is where physicians have to register in order to obtain appropriate identification numbers for practice. This particular physician, Dr. Goldberg, is internal medicine, has 3 different specializations: cardiovascular disease, nuclear cardiology, and interventional cardiology. And this individual had 20 Medicare patients. 27 times he delivered 99213 in a facility setting, and it was $160.22 each. Now, you're probably aware, and you will see it later, that there are many locations where services can be rendered, but most of those locations have been collapsed into two broad categories, office and facility. And there are specific definitions for what would fall under a facility and specific definitions for what would fall under an office. At this point, we will click Continue to go out of the print preview stage. Now, if I wanted to modify the last search, so I would just simply click Modify the last search. And for whatever reason, maybe we want to look for a pain management specialist in Phoenix with this service. We'll click Continue. And this brings up 19 records. I will go to Zoom 150 so we can see this better. And Dr. Rubin is defined by provider type as interventional medicine, interventional pain medicine. And he provided 1,390 services, 99213 in an office setting, on 397 Medicare patients with an average submitted charge of $184. And once again, you can see these numbers decrease based on the number of services each provider provided. So 1,390, 1,365, and it goes down until the very last individual, Dr. Skirgan, provided this service 35 times to 24 Medicare patients. And the final numbers here is the total line service count, the patient count, the average submitted charge. So this service was delivered 8,899 times by this group of healthcare providers on 3,270 Medicare patients. But keep in mind, this is not unique Medicare patients, meaning this physician, Dr. Felix, may have seen a patient seen by Dr. Castillo, and that Medicare patient would have received a service from each of them. So we do not know the number of unique Medicare patients provided services by this group of healthcare providers, but we do know if you add up the individual ones provided by each physician, it would be 3,270. And the average submitted charge is $176.52 for 99213 in an office setting by this provider types. At this point, we will go back home, and then we can begin another process. And basically, when you click to begin the search, you can put in your CPT codes, state abbreviation. For now, I would not worry about country, although at some point you may want to look in other countries where these services are provided and paid for by Medicare. City, you can search by a 5-digit zip, and you can search by a 3-digit geo-zip. And once again, the provider type is a drop-down menu. You cannot modify this list without some effort, and I would have to walk you through that. These terms are specifically defined, and if you start changing the spelling or adding definitions, then you may not get a proper search result. But it includes physicians, MD and DO. It also includes social workers, psychologists, physical therapists, occupational therapists, and many different provider types. And there will be a printout reflecting these various provider types that you can review. At this point, I will go back home. And typically, if you're on a screen and you're not sure what to do, there will be a button at the top left that says either go home, or there'll be an arrow that you can click on, or there'll be a word that says go back. So let's go back to the home screen. And then once we're finished, we'll close the file. And when we're ready to use it again, we'll go back to the shortcut and double click it.